sometimes the dentistry is easy. It's kind of the in-between stuff. And I think it always comes down to how do you leave a legacy and how do you have the biggest impact you can on patients and staff and people that you're around every single day. And so that was one of the big drivers for me to meet Kelly is how do you go about this thing that we call life with dentistry as a means to impacting other people. Kelly's one of those people where when you just sit in the room with Kelly, you're learning, whether you think you are or you're not. Just that presence there is huge. And that's what I felt with him the first few times that I met him and at some of our congresses that we enjoy together. And it's almost like there's a nugget of something in every aspect that I have to kind of like, no pun intended, I have to digest a lot and like say, hey, this is amazing stuff. How do we move forward with it? I think the biggest thing for me was, to get into some of the weeds, his new patient experience is amazing. So how can we take the complex and make it simple? That's a big one. And in dentistry, very few people I think do that well. He's one of the best I've ever seen at taking that and getting things across to a patient so they can truly understand something and then make a decision, an informed decision on what's best for them. So that's the biggest thing I took away from day one is kind of this overarching complexity to simplicity type of mentality, and that's huge. And it takes a lot of the haze out of dentistry, especially from a patient's perspective. I think one of the biggest things there is Kelly's amazing at telling you this is how I do things and this is my approach, but you don't come here and copy and paste. Like you be you. Your experiences, what you've been through up to this point, where you're going, and what your vision is, don't have to be exactly what mine are, but this might help you along that way. And so I think that's been huge. And taking that back and helping my staff, even from a standpoint of taking something complex to being simple, is just as big as it is for a patient. If I can't empower my team around me to hop on the bus and be a part of the vision that I have for patients in dentistry, then I'm going to struggle the whole way. Yeah. And so he's been really big on team, and we are huge on team. Our team is like a family to us, and so. Without them, we aren't near what we hope to be. What I would tell another prospective dentist kind of looking at these programs is you've seen one way. The system tells us to do things a certain way. Rarely is that the best way. And so as much as a dentist, especially in our field of biologics and integrative dentistry, we're used to thinking outside of the box. We're used to thinking in a different manner. But you can do that in life in general, not just professionally, but personally, how you manage and run your staff and your practice, how you come through to a patient. All of that can be different. And we're already different in our scope of practice anyway, because we've been able to come to terms with, hey, I see things differently. But that can be applied to all aspects of your life. And so Kelly's been really good at saying, dentistry in general tells us this is how you should run a practice. That doesn't matter. Yeah, what's right for you? What do you want out of your life? And design it to fit. Design it to use it as a vessel to get what you want in life. And that's huge.